Okay, I'm going to start by saying a couple of words about the directive itself and then about the role that the MHRA will take and how we're going to regulate e-cigarettes as consumer products. And then I'll contrast that and talk a little bit about what we do at the moment with medicinal products. Okay, so Tobacco Products Directive is mainly about tobacco, but it does have this one crucial article about e-cigarettes, which establishes a set of rules for regulating the products as consumer products. And it specifically excludes those which are subject to the separate medicines licensing regime. The Department of Health, as the competent authority, led a public consultation and Alette's told you about that, so I won't say more about that. But the key date that is engraved in all our minds at the moment is the date for national implementation in May. And so we've got a lot of work to be done between now and then to implement the new requirement for a notification scheme for electronic cigarettes in the UK. And just as a reminder to think about as I'm talking about what the aim was to produce this notification scheme was, the first one is about standards and quality. And actually the industry is doing quite a lot of work with standards bodies and with some of my colleagues in the MHRA who are more on the science and licensing side to think about what the standards should be for these products and developing a standard that people will have available to work towards. Second purpose is obviously about transparency and information people so they can make choices, and we've heard a lot about that this morning. And the third one about protecting children from being able to use these products. I wanted to just flag out in particular things that we will be having to implement. These are in the directive that there is a maximum cartridge or tank size for e-cigarettes, a maximum size for refill containers and concentration. Now, at the moment, the market is much more wide than this in some areas, and so that is definitely going to have an effect on the market. So turning to our role, the directive requires that all manufacturers and importers of electronic cigarettes submit a notification to the competent authority, and MHRA is the competent authority in the UK, and different countries have chosen different organisations to be. Often it's the Department of Health itself, but in the UK it's the MHRA. And so we are working to set this scheme up between now and the 20th of May. And at the start, I think it's very important to say that we see this as light touch regulation. If I show you the vision that we currently have, and this is our published vision as the MHRA, it talks about the effective regulation of medicines and medical devices. Obviously, electronic cigarettes as consumer products don't fit into either of those areas. And so I've been having a lot of interesting discussions with my colleagues about just how we're going to implement this. And we have to keep reminding ourselves, no, it's not like medicines. And there are some similarities with some of the devices notified body schemes, but only superficially. And so we are very concentrated that we are not intending to implement this in a way that is like medicines or like devices. It is a notification scheme, and it will be a light touch regulatory scheme that we'll be implementing. And our focus is actually going to be on safety in use, which is actually very much what happens at the moment with trading standards officers, and we're going to bolster that with the expertise of the MHRA in this area. So, proportionate notification scheme. We're looking very closely, like Alette was saying earlier in her aspects, at exactly what the directive says and exactly what we need to implement and what we need to ask of manufacturers and importers. The key requirement is that 6 months before they intend to place a product on the market, they will need to submit a notification. In fact, it will be through a European portal, but it will be to us in effect, giving details of the product that they intend to market. We will then look at it. We will then charge them a fee. We will be consulting on that in the months to come. The MHRA is a trading fund, and so we have to recoup our costs. It's not going to be fee-like for medicines. It will be much smaller than that. I can assure you, because we have to, under Treasury rules, make the fee commensurate to the amount of work we're doing. So we're not going to do the same amount of work as we do for a medicine. When we get to the end of the process and the notification is valid, then we will be publishing the data, with the exception of information that the company considers to be confidential. So people will be able to find the information about the products that are notified in the UK. Just to give you a bit of flavour of the information that we're going to require: ingredients, toxicology data, nicotine dose, components and production dose. This is obviously much, much less than you would be required to submit if you're applying for a medicines licence for your product. And just to take an example, the nicotine dose, we are not going to require studies in humans to prove that the blood levels of nicotine are a particular level, or that the product reduces craving, because of course the company will not be able to make any claims in that area. So that's the kind of basic information that will need to be submitted. There are also a number of packaging requirements that are designed to make sure that when you're using the product, it is safe for the consumer, around child resistance, tamper evidence, no leaking, and there will be a leaflet, and there will be the inevitable health warning as well on the product. But reminding you it's a notification scheme, we are going to rely very heavily on the declarations that the manufacturer importer has to submit to us as part of their notification. The manufacturer has to declare that their product conforms with the requirements of the directive. We will not be verifying every single aspect of that, although we will be looking at applications. They have to declare that the manufacturer or importer bears full responsibility for the quality and safety of the product on the market and in reasonably foreseeable use. We are not going to verify every aspect of what it is that the company is claiming. So, just want to make it very clear, that's what a notification scheme is. They tell us, we perform some basic checks, but completely unlike a medicines licensing scheme where companies would tell us that we check everything to the nth degree sometimes, but it's not that kind of a scheme that we'll be setting up in this area. What we will be doing is thinking heavily about how we monitor the use of these products in the market. The directive puts a clear responsibility on the manufacturer to make sure that they can collect any information that comes to them about the safety of the product in use, and that they investigate whether there is a safety issue relating to their product. And there's a requirement for them, having done that, to report to us as to what they've done, if anything, and to tell us about it. And we will obviously be able to look at those reports and say, yes, we think that's adequate response, no, we don't. We have an existing yellow card portal, which is the main way that we as an agency use to collect information about the products we regulate in use. It collects information about adverse reactions to medicines and problems with medical devices, counterfeit products and defective products. We are anticipating at the moment that we will add an extra button onto that scheme to provide so that people can report if they have a problem with their e-cigarette. Now, you'll have seen the headlines about the things that most people have a problem with about their e-cigarettes. They're not really about the nicotine in the product. It tends to be the exploding battery or something like that. So we will be working very closely with trading standards. And the directive gives us the power to take provisional action, which can be as much as recalling products from the market. And it then requires us to go and talk to our European colleagues to make sure that we're not doing something completely outlandish in the UK, and similarly in other countries, and so to coordinate and harmonise the action that's taken on safety issues relating to products. So we are at the moment talking very much with trading standards colleagues across the country. Obviously they have an existing responsibility for electronic cigarette products on the market. If there's a problem with an exploding product, it's their responsibility at the moment, and that's very much what will happen in the future. So when I was talking about our yellow card reporting scheme, we're anticipating simple triage system that says, is this for us, is this for the trading standards? And we will work together to make sure that any reports that we have come in and go to the most appropriate body to deal with it. And so we're working very closely with trading standards colleagues to agree a framework for this, and with colleagues at the department putting in training for trading standards staff so that they know how this whole system will work and what their responsibilities are and how they work with us and with all the other bodies that are involved in the other parts of the Tobacco Products Directive as well, because it's not, this is just one part of the activities. And obviously to make sure that we have effective data sharing across our organisations to ensure effective handling and support for each other. So, having talked about the notification scheme for consumer products, medicines products, I'll give you pictures of the two products that are currently authorised. Of course, both of them are inhalator products rather than true e-cigarettes, though they do fit the definition in the directive. And the key difference here, Rob was talking just now about all the work they've done about making sure that e-cigarette products don't make inappropriate claims. These products can make smoking cessation and harm reduction claims. And I showed you at the start the limits on sizes of tanks and nicotine concentrations and so on. These products are not restricted in the same way, provided you can prove that the product would be useful for the I want to say patient, but it's normal, not, you don't really see a cigarette smoker as a patient. It would be useful for the individual. They can get a licence without having to meet those parameters in the directive. And obviously, we would be looking in our usual way at medicines. Deborah Ashby very kindly supported us this morning. We have looked at the degree to which we look at marketing authorisations for these products. We've talked with a number of companies to advise them on how to get into the medicines licensing scheme. We are doing that in as proportionate as a way as possible, and we do hope that there will be at least one other product. You're aware that there's another product in the authorisation scheme at the moment that is a true e-cigarette. We would expect to see sometime in the not too distant future that there will be another marketing authorisation for a product. And I wanted to just flag up, this is the typical indications for use for a licensed nicotine therapy. And the key bit is at the bottom of the first paragraph, as a safer alternative to smoking for smokers and those around them. So these products, when they're marketed, will be able to make clear, safer alternative claims. And I think that's, in the context of all the discussions that we've had this morning, that's going to be a very interesting thing. We went through, over the last few years, thinking as thinking moves on, as we saw this morning, a few years ago, we had really big discussions about whether we could remove the restrictions on giving these products to people with cardiac conditions, because, of course, there was a risk. And so we were about minimising risk and so on, so we couldn't possibly. And it took us a number of years to get to the point where now all the summaries of product characteristics for the products, they all say, more or less, there are no circumstances where it's safer to take a cigarette than to take these products. But it was a passage of time that allowed us to get to that point, and a number of steps along the way as we gradually relaxed the restrictions on the use in particular groups, and we gradually increased the indications, and the safer alternative took us quite a long while to get to that. So it is an evolving area, and regulation does move on and listen to that. And we are very carefully looking at how we regulate the products and medicines, and also very much how we implement the notification scheme in a way that achieves the aims of the scheme, but without throwing the baby out with the bathwater. We are at a fairly early stage in what we're doing in developing the notification scheme. In the new year, when the government response is published and our thinking has moved on and we have more information about it, we will be progressively putting out information and guidance to manufacturers and importers who want to submit notifications as to how they might achieve that. We are not expecting a huge wodge of applications at the very, very start because, of course, people on the market have 6 months from the end of May before they actually need to submit a notification. So there's quite some time for them to get used to the scheme, but we will endeavour to make sure that we have full information out by that time. But in the interim, if you want to register as an interested party to get information as it develops and as we produce it, please do sign up to our scheme. If you have a particular question, somebody talked to me earlier today and made a really good point about how you're going to cope with this situation when you're notifying. Will it have to be one notification or many notifications? And those sort of questions can be really useful because at the moment we are still designing the scheme. So there are changes that we can make that will facilitate those things. So if you have a particular question, we're very happy to talk to you about how we're implementing it to make sure that we make it as fit for purpose as it possibly can be. Thank you.